Malnutrition remains one of the most pressing global health crises, impacting millions of individuals across the world. It is a complex issue with far-reaching consequences for individuals, communities, and nations. Malnutrition encompasses both undernutrition, including hunger and micronutrient deficiencies, and overnutrition, such as obesity and diet-related chronic diseases. Addressing malnutrition requires a multifaceted approach, involving global cooperation, policy changes, and community-level interventions. Malnutrition is broadly categorized into two main types. Undernutrition. Hunger arises when individuals do not have enough food to meet their caloric needs. Starvation, a more severe form, results in extreme deprivation of food, leading to severe health complications and death. Characterized by severe weight loss and muscle wasting, wasting results from acute malnutrition. It is often seen in children under 5 and can lead to stunted growth and development. Stunting refers to chronic malnutrition, where children fail to reach their expected height for their age. It is a result of prolonged undernutrition and can have lifelong effects on cognitive and physical development. These deficiencies occur when individuals lack essential vitamins and minerals, such as vitamin A, iron, and iodine. Micronutrient deficiencies can lead to severe health issues, including impaired immunity, anemia, and developmental delays. Overnutrition. Overnutrition leads to excessive weight gain and obesity, which can result from an imbalance between calorie intake and expenditure. Obesity is associated with a range of chronic health conditions, including type 2 diabetes, heart disease, and certain cancers. Poor dietary choices, such as high intake of processed foods and sugars, contribute to diet-related chronic diseases like hypertension and cardiovascular disease. The global impact of malnutrition. Malnutrition is a significant global challenge with wide-ranging effects. Health consequences. Malnutrition, particularly in children, is a leading cause of mortality. Wasting and severe hunger can lead to death, while micronutrient deficiencies increase susceptibility to infections and other health issues. Undernutrition, especially during early childhood, can lead to stunted growth, cognitive impairments, and developmental delays. This has long-term effects on educational attainment and economic productivity. Overnutrition and obesity contribute to a rise in chronic diseases, including diabetes, heart disease, and certain cancers. These conditions place a significant burden on healthcare systems and reduce quality of life. Economic impact. Reduced productivity. Malnutrition impairs physical and cognitive abilities, leading to reduced productivity and economic performance. Inadequate nutrition affects workers' efficiency and increases absenteeism, impacting national economic growth. The health care costs associated with treating malnutrition-related conditions are substantial. Governments and healthcare systems face increased expenditures on medical treatments, hospitalizations, and long-term care for chronic diseases. Social and developmental consequences. Malnutrition, particularly in children, negatively impacts educational outcomes. Cognitive impairments and health issues result in lower school attendance and academic performance. Malnutrition disproportionately affects vulnerable populations, including low-income families, rural communities, and marginalized groups. This perpetuates cycles of poverty and inequality, hindering social and economic development. Root causes of malnutrition. Understanding the root causes of malnutrition is essential for developing effective solutions. Key factors include food insecurity. Food insecurity arises from a lack of access to sufficient, safe, and nutritious food. This can result from poverty, economic instability, and inadequate food distribution systems. Inefficient agricultural practices and climate change impact food production and availability. Issues such as soil degradation, water scarcity, and extreme weather events affect crop yields and food security. Socioeconomic factors. Poverty is a major driver of malnutrition, limiting access to nutritious food and health services. Low-income families often prioritize inexpensive, calorie-dense foods over more nutritious options. Lack of education about nutrition and health contributes to poor dietary choices and ineffective feeding practices. Educating individuals and communities about nutrition is crucial for improving dietary habits. Health system challenges. Limited access to quality health services, including prenatal and maternal care, contributes to malnutrition. Health systems may lack resources for screening, diagnosis, and treatment of malnutrition-related conditions. Insufficient support for breastfeeding, inadequate maternal nutrition, and lack of early childhood care contribute to undernutrition and poor health outcomes in children. Cultural and behavioral factors. Cultural beliefs and practices regarding food and nutrition can influence dietary habits. For example, traditional practices may prioritize certain foods over others, affecting nutrient intake. Eating patterns, such as high consumption of processed foods and sugary drinks, contribute to overnutrition and obesity. Behavior change initiatives are needed to promote healthier dietary choices. Addressing malnutrition. Strategies and solutions combating malnutrition requires a comprehensive approach that includes immediate relief efforts, long-term strategies, and systemic changes. Improving food security. Investing in sustainable agricultural practices, improving infrastructure, and supporting smallholder farmers can increase food production and availability. Strategies include soil conservation, water management, and climate-resilient crops. Improving food distribution systems and reducing food waste can help ensure that nutritious food reaches those in need. Implementing efficient supply chains and food safety measures is crucial. Promoting nutritional education. Educating communities about nutrition, healthy eating, and cooking practices can empower individuals to make informed dietary choices. Programs that promote breastfeeding, balanced diets, and food preparation skills are essential. Incorporating nutrition education into school curricula and providing healthy meals in schools can improve children's dietary habits and overall health. Enhancing health services. Expanding access to health services, including screening, diagnosis, and treatment for malnutrition-related conditions, is critical. Investing in health infrastructure and training health professionals can improve care delivery. Supporting maternal nutrition, promoting breastfeeding, and providing early childhood care are essential for preventing undernutrition and promoting healthy growth. Addressing socioeconomic factors. Implementing social protection programs, such as cash transfers and food assistance, can reduce poverty and improve access to nutritious food. Addressing income inequality and providing economic opportunities are also important. Promoting education and empowerment, particularly for women and marginalized groups, can improve nutritional outcomes. Educational programs that address gender disparities and provide skills training can have a positive impact. Fostering global collaboration. Tackling malnutrition requires global collaboration and support. International organizations, governments, and non-governmental organizations, NGOs, must work together to implement effective strategies and share resources. Supporting research and innovation in nutrition, agriculture, and health technologies can lead to new solutions for combating malnutrition. Investment in research and development is essential for addressing emerging challenges and improving interventions. Looking ahead. The path to a malnutrition-free world. The global fight against malnutrition is both challenging and urgent. As we move forward, it is crucial to remain committed to addressing the root causes of malnutrition, implementing effective interventions, and fostering collaboration among stakeholders. By focusing on improving food security, promoting nutrition education, enhancing health services, addressing socioeconomic factors, and fostering global cooperation, we can make significant strides toward reducing malnutrition and its impacts. Achieving a world free from malnutrition requires collective effort, dedication, and innovation. It is a challenge that demands the involvement of governments, organizations, communities, and individuals. Together, we can build a future where everyone has access to the nutritious food they need to thrive, where health disparities are reduced, and where individuals and communities can reach their full potential. In conclusion, addressing malnutrition is not just a matter of providing food. It is about creating a sustainable and equitable system that supports the health and well-being of all people. By prioritizing nutrition, investing in solutions, and working together, we can overcome the challenges of malnutrition and build a healthier, more prosperous world for future generations.